Arranging for healthcare coverage can be tricky. But once you have it, using it should be simple. You find a doctor, and when you get sick, you call them and get treatment. Easy enough. Except when it isn't.
Any large system is really organized around serving folks from sort of the dominant culture. In our society, that is white, cisgendered folks who, from a certain income level, who are able to navigate that system really easily because the system makes sense to them.
This is Elise Sanchez, the executive director of the Oregon Community Health Workers Association, or ORCHWA.
A community health worker is a frontline public health worker that has a very close relationship with the community that it serves, or is part of the community that it serves. They are the ones who are in their community hearing from folks, this is why I don't go to the doctor. It's not because I don't want to be healthy. It's never because we don't want to be healthy, right? But it's because I don't feel comfortable there. I don't feel served there. They don't speak my language. They don't understand my culture. You might see 3 different doctors for 3 different things, and at no point are you sort of considered as a whole person. And community health workers are really looking at all of the things in a person's life that come together to make this particular person, this particular set of circumstances, and how we work within that sort of universe to move toward your goals around health.
Meet Marcelena and Abel. They're from El Salvador. A few years ago, Marcelena started feeling pain in her abdomen. She called her insurance company, but never heard back. That's when she met Guadalupe, a community health worker. Guadalupe helped her see a doctor right away. It turned out she needed an emergency gallbladder operation. Guadalupe guided her through both the surgery and the healthcare system. Marcelena didn't have health insurance, but with Guadalupe's help, the surgery was performed at no cost to her.
Cuando ella llegó, yo sentí que todos mis problemas se fueron, porque empezó a solucionarlos uno por uno. Vamos a hacer esto primero, después esto, y después esto, y después esto. Y todo fue funcionando bien. Todo empezó a ser, bueno, ya está. Yo ya, como dice, ya me siento mejor. Tanto de salud como económicamente, bueno, me siento bendecida porque pues tengo esto. Tengo mi hogar, estoy aquí, podemos pagar nuestra renta y todo. Ya estamos caminando bien.
Nosotros estamos más cerca de la comunidad y ellos comparten con nosotros muchas de las experiencias que tienen, que yo he pensado que un médico a veces no captan, tienen 20 minutos nada más para poder atender un paciente y no tienen el tiempo que nosotros tenemos para sentarnos, escuchar, mirarlos a los ojos, mirarlos respirar. A veces un médico no va a tener ese tiempo, no va a poder hacer eso.
Thanks to the work of community health workers like Guadalupe, the healthcare system as a whole can start to identify the real obstacles these communities face when it comes to their health. Obstacles like rent, housing, and transportation.
I have firm belief that the community health workers are going to improve the quality of services and the cultural competency of services in the healthcare system. It's going to be amazing.
That's why HealthShare of Oregon has invested $3 million in ORCHWA, allowing them to expand training, grow their network of community health workers, and make it easier for health systems to integrate community health worker services.
I think we are moving toward a healthcare system that is able to see health as more holistic. That health isn't just about what we do in the doctor's office. It's really about what are the conditions that you're dealing with in your community, in your family, spiritually and mentally. All of it comes together in a balance to create, your particular needs around health and wellness. I think that HealthShare really sees that vision and is really executing on it in our community.
5 or 10 years from now, people will be saying, how did we ever live without that? How did we ever expect we were going to be able to pull this off without an agency like the Oregon Community Health Workers Association? If we manage that, then I will consider this a very well-placed investment.
To learn more about ORCHWA and the other ways that HealthShare of Oregon is working to increase access to culturally appropriate care, visit healthshareoregon.org.